Okay, thank you for the introduction again. Nice to see some new people and some of the people from last week as well. So I'm going to pivot a bit away from the clinical aspects and even away from the kind of data aspects we were talking about last week when I did the 2 seminars there. And I'm going to talk to you a bit about data sharing and how we can do that ethically and equitably. And I know it's the last session of the day, so I'll try and be interesting. I know it's not everyone's excitement area. In fact, often when I mention ethics, I can sort of hear a collective groan from everyone. But if it makes you feel any better, I'm more interested in my work in building tools that makes it easier for researchers to do ethical work. So I'm not really interested in going on and on about the problems. I'm more interested in finding solutions. And then, so I'm going to be talking here about why we should do data sharing, when we can do it, how we can do it well, and also a bit about benefit sharing, which I think is not talked about enough. And then I'm actually going to tell you a bit about my own work, which I hope is an interesting story and might be, I don't know, a new perspective on how we can do things. So yeah. Also, I've got another talk on Wednesday, which is about data governance. So I tend to, it's my own kind of way of thinking about it, but I think about ethics as being what should we do? What's okay to do? And governance as being how should we go about doing it? So what are the infrastructure and the structures that help us to do things properly or ethically? So ethically, more, for me, is more about what's okay, what's not okay, and how can we do what we want to do with data and still do it ethically. I think for most of us in the room, data, we're involved in the data ecosystem, we're generating data, we're using data, and I think often for machine learning approaches, data availability is a bit of a bottleneck or a bit of a hard point to deal with. So, and then also there's some fantastic data sets out there, but you can't actually use them because the ethics are not in place or the informed consent hasn't been done. So why should we be doing data sharing? So, and I'm talking a lot here about as well about sharing data onward. So often there's a primary study and it's done in a very specific way to answer a research question. But I think often for those of us in the machine learning space or in the data analysis space, you're repurposing data sets that were maybe collected for another purpose. So I'll talk about that as being secondary use or onward use of data sets. So they've been generated for a study, but now we want to use them for other things going forward. So participants make our health research possible. We ask them to invest often a lot of time and energy. They come for appointments, they fill out surveys, they answer questions, and they even sometimes come in for follow-up visits. And we also ask them to take various risks, data privacy. Sometimes they take new treatments, try new treatments. They have health interventions, and they also donate samples. I mean, it's quite a big ask. So although it's an ethical requirement to do the work in an ethical way in terms of protecting privacy, etc., there's also an ethical requirement to use those data and biospecimens we collect to do as much good as possible, to use them well, to do as much research as possible, but of course, while still staying within the framework of what's been approved and what's acceptable to the participants themselves. So we want to really ethically share data and biospecimens in order to be able to keep doing as much good research as possible. So it's also better for our research, selfishly. We want to do data sharing because we can get a larger sample size, can get better significance for our findings, be more confident in whatever effect size we're seeing. We can use validation data sets, and we can have more generalizable findings because we can test our hypotheses more widely. So also for the research kind of ecosystem, the bigger the data sets we can use, and the more we can use data for secondary use, the better research we can do in a technical way. But we have to find a balance. So there are a lot of benefits that I've just outlined, but there are also these risks to participants of risks to their autonomy. Are their choices being respected? Do they have some say over what's happening with their data or their biospecimens, and also their privacy, especially for health, which is so sensitive. So we're trying to balance, the SDGs, the third goal for good health and well-being. That's a very clear benefit, and that's probably why most of us are in this field, is we want to do something good, help to improve the health and well-being of all our populations globally, and to advance science. But we have to really also think about like the UNHCR principles: protection from discrimination, protection of privacy, protection of reputation. And these are things as data scientists in health that we can really, these are spaces where we could really do significant damage. So we need to be on it, and we need to all take responsibility for how we work with data going forward. So when can we do data sharing? I mean, the first point is when the law allows. So I'm going to talk a little bit about examples from South Africa, because that's what I'm familiar with, but I'm very sure that there's similar legislation in any country where you do this kind of work. We have primarily a Health Act, which really protects and locks down patient confidentiality. So if a patient or a healthcare client is consulting for the purpose of healthcare and receiving healthcare, there are very strict laws that define what can happen to those data next. And we also have a Protection of Personal Information Act, which is very similar to the General Data Protection Regulation in the EU, which made a big splash. Our POPI Act is very similar, Protection of Personal Information Act. And then there are various other acts: protection of minors, protection of people who are living with disabilities. There are so many different acts that all have a kind of window in on protecting data from individuals, and specifically health data. Yeah, I just mentioned, so in clinical research, the health data collected at a health facility where a client has a consultation with a healthcare provider, those are the primary reason for collection is that those people are looking for healthcare. And there's kind of an implicit contract with the healthcare provider that you're giving over all your personal health information in order to receive healthcare. You don't, well, certainly in South Africa, you don't sign a document every time you see a doctor to solidify that agreement. It's inherent in in that interaction. And yeah, the healthcare provider can't simply collect or scrape all the data from all their patients and write a paper about that in the research world. Some of them might do it, but legally they're not allowed to. Yeah, so I already spoke about our Protection of Personal Information Act. Actually, our POPI Act, it actually identifies health data as special data. And I wanted to flag that just to say, even in legislation, the very sensitive and very personal nature of health data is enshrined in these extra layers of protection. The Protection of Personal Information Act, and I think the EU GDPR is the same, distinguishes identified data versus anonymized data. So there's certain rules if you can tell who the data came from, and then there are other rules if you really can't work out where the data originated or from which individuals. And if there's any way of identifying the data, you have to have very clear informed consent from the participant before you're able to use the data for any purposes other than the provision of healthcare. So there are these different roles. This is just to show you it's a very technical kind of setup with different roles. There's a responsible party who collected the data and is the data steward. Yeah? So in the So I think for research purposes, for properly anonymized data, to my knowledge, and I stand to be corrected, I think that those have a slightly more lenient sharing ability. No, it's yeah. Yeah. Yeah, so it's a good question. So, and we're going to talk a little bit more also about what's de-identified, what's anonymized. We have, I mean, I wouldn't say exempt from the Act. There are clauses in the Act that speak to de-identified or anonymized data. And there's certain restrictions as to what you can or can't do with those data. But with de-identified or anonymized data, there's a lot more you can do without consent compared to other, you know, to where you have some kind of method of identification. My understanding is our Act in South Africa is a little bit more stringent than the EU Act. So I actually think, yeah, de-identified or anonymized data in general, you can share much more freely. I wouldn't say completely freely, but with, yeah, it's easier, let's say. And I will come to that. We'll talk a bit more about that.
Oh, that was me, Rahul. Yeah. Now, some months ago, we were discussing exactly a similar question with the Gates Foundation people, and this guy who you probably know, Vishak Subramani, was saying the South African law is extremely stringent in that if there is any possibility of identifying an individual by combining little datums from, you know, the shared data, then there are criminal consequences for it. Something like that. He made a major sketch story out of it. And he was saying this.
We'll talk about that some more. Yeah. Okay. No, it is. I mean, that's using the word de-identified versus anonymized. They're very specific.
Yes.
We'll talk about that as we go. Is that okay? Yeah. But do interrupt if you, I mean, just flag and make me stop talking if you've got more to add as we go. Yeah. So we also have, so you have the responsible party who holds the data and holds responsibility. And then you have in the POPI Act is called an operator. I think EU, it's a processor. They're people who are given the right to do certain work with the data, but they can't do anything of their own accord with the data. They fulfill a specific purpose and they return the results to the responsible party. So that relationship is managed by the responsible party. The data subject or the person from whom the data were collected, they have then the relationship with the person, the organization collecting the data. And then you have third parties. So this would be us as researchers if we wanted to use, for example, health data that had been collected. So secondary use, onward use, third party use, these are all the things that I will talk about more because this is where it becomes quite a gray area and it's quite tricky to manage. Yeah, so this was what we were talking about with identified health data. And that means you may take off the name and the surname and maybe the health identifier, but you've left in the national identifier. If data can be re-identified by comparing with other data sets somewhere else, you can only refer to that as de-identified data, not anonymized data. So, yeah.
That's exactly what I can you actually put some theoretical guarantees on what is de-identifiable in health data if we put in genomics and everything in that? So do we have any, because when you're talking about legislation, there must be some theoretical guarantees too.
Yeah, so there's no specific information in the legislation. What I can tell you more about, I mean, in the area of genomic data, you actually can't share on genomic data without specific consent from individuals because it's uniquely identifying. I hadn't actually thought about the eye, the retinal imaging being similar. It's like, and I mentioned it last week, it's like me giving you my thumbprint and saying, can you anonymize that? So no one can ever link that thumbprint back to me. It's not possible. Genomics are the same. So we can't send big genomic data sets around if we don't have consent to do so. Yeah. We'll talk about it some more, yeah, because it's very difficult actually to make those decisions. And there's certain tools you can use. So as a researcher, your aim is to try and make your data as non-re-identifiable as possible. But there isn't a specific cutoff, just some rules of thumb, yeah, which we'll talk about, yeah. So with informed consent about the primary use, the responsible party might know who's in there. But for identified health data, you can't just take those primary data and hand them on to some other user unless you have specific informed consent to do so from the data subject. So when can we do data sharing? I mean, specifically, we've been talking about it, informed consent, when the participant agrees. So as long as you can, and whenever you can, you should just ask. It's actually, people are often intimidated by informed consent protocols, but it actually doesn't have to be that difficult. And you can ask your participants. Obviously, this is very different when we're talking about very large granular data sets that have been generated through other purposes. We'll talk about those situations a bit more. But wherever you can, you just ask before you do stuff. And that's a great premise to start your process of ensuring that the work you do is ethical. We use tiered consent in our studies. I think I put here, so we actually published, for anyone who uses REDCap, we built a template to help people do tiered consent better. The way it works is that you can import the template, and then it prompts you, it pre-populates everything and gives you a really solid informed consent process in REDCap, but you can modify, obviously, to make it specific for your study. We've thought of as many clauses as we can that should be in there. I think, it grows all the time. We've now got, I think there was something like 17 different questions. So our process is that we explain something, we ask a question about it. Are you okay with this? Are you not? Yes or no? Then we explain the next piece, and then we ask about that. We find it easier than just, dumping this huge amount of information on our participants. Then at the end saying, so is all that okay, or is it not? Because at the end, I say that broad consent, it can be consent for everything and nothing in the same breath, because you can't actually work out from a one yes or no exactly what the participant's happy with. Yeah. And then, of course, if you're going to do that kind of more granular consent process, you need to capture that information. So that's why we built it in REDCap, so that at the end, if you say, okay, we want to use data from all the participants who said they're okay for this study and additional diabetes studies, you can very quickly, with a query, pull out the list of who those people are, pull out their data in a very automated way. Up to now, I've seen in many clinical studies, when you say, can we use the data where they agreed to X, Y, Z, they actually go back to the paper forms and they have to go through each one manually and see which participants agreed or disagreed. So we're trying to inculcate some better practices, certainly with our collaborators, where they actually capture these things well. Yeah. So that's there for anyone who wants to use it. Yeah. And for us, we use both routine health data, so medical health records, digital health records, and we also do genetics, genomics work. We've particularly built the prototype with quite straightforward language that we've kind of, to some extent, user tested to try and explain genomics, etc., for population groups that really don't have a background in that kind of biological education. So we can do data sharing when the participant can't be identified or very specifically re-identified. And this was what we were talking about. So data are de-identified when you take off the names, the ID numbers, the folder numbers. For us, a folder number is like the hospital number. It's everyone has a specific number that is universal across the health service in our province. That's, so if I refer to folder numbers, that's what that is. And data are only really anonymized if the data are de-identified to the point that they can't ever be relinked to an individual. So a classic example would be, maybe I gave a de-identified set of data from a clinic, and in that clinic, they have all the folders, and they could go and see who was in the clinic on that day of that age and work out who's who. That would be a de-identified data set, because they'd be able to re-identify the individuals. And then, yeah, of course, with the kind of data sets we're using for machine learning, genomics, but also routine health data, actually any kind of very, very large granular data, the risk of re-identification is really, it's very real. So actually, when we work in the space we have to think very carefully about whether the data we're working with are truly de-identified. And if you're not 100% sure, one of the first things you can do is stop treating the data as though they're anonymized and start behaving as though they are identifiable data. And we'll talk in the data governance talk about some of the things that one should be doing to make sure that you're treating the data with the necessary care and responsibility. So I'm going to talk a bit about data perturbation. We use this quite a bit. So one of my many hats I wear, I work with, we have a large health information exchange in my province. So I actually stepped out of academia for about 4 years, and I was part of the team that built it. And those data are fantastic. They're all the laboratory data from the National Laboratory Service, all the dispensing data, all the facility visits for every individual. It's about 7.5 million people who are actively in healthcare in the province. But we do, in certain circumstances, release those data for research. And although it's not the main reason to have this health information exchange is continuity of care for the healthcare clients. But when they are able to be used for research, even within the service, epidemiological research, we have to de-identify those data. So we've got very good at data perturbation. We've already talked through this about having to anonymize health data if you want to pass them on. This was just talking about this idea of data being re-identified. We kind of jumped the gun a bit, but it's just to say here, if you think about a data point and you say it's a 37-year-old lady with epilepsy who attended a particular clinic on 4 particular dates, it's not very hard for someone with access to the folders in the clinic to work out who that person is. Or I've actually seen, a 12-year-old female learner who lives at and if you know it's grade 6, you know the age anyway, who lives at this address in this suburb. I mean, it's really, you really can't pretend those are anonymized data at all. The other one, I think I mentioned it actually last week, this thing of birth weights, it traps us all the time. So, a female baby born on this date at this particular maternity clinic with a birth weight up to 5 decimal points. You may as well create an ID number of those 5 decimal points, because the chance of another child being born with that birth weight recorded is very unlikely. And the birth weight gets transcribed extremely accurately as it was recorded. So this particular number down to these 5 decimal points will accompany that child's record throughout their life. It becomes almost identifying. And as I said, you don't want to manage de-identified data in the same way as properly anonymized data, because actually they can be re-identified. So data perturbation, what I mean by data perturbation is making these shifts and adjustments and tweaks to the data set that change the actual numbers and the actual recorded elements in the data set, but they don't change the underlying epidemiological patterns or relationships in the data. And it's also on a kind of need to know basis. So often you look at the field and you think, does a researcher really need to know exactly this? So often for adult epidemiological studies, actually you only need to know the age of the participant in years or their year of birth. You really don't need to know the exact day on which they were born. It's too much information. You don't need it in an adult study. A difference in age of 3 months in an adult is not really going to change your epidemiological inferences. So in most cases, we would only put in year of birth for adults. And we have a kind of scale. So we'll put age in days for neonates. We put age in weeks for newborns, I think up to about 6 weeks. Then in months up to about 24 months. And then after that, we start going to age in years. And we don't provide birth dates because they're so identifying. Sometimes if the data set is for kind of longitudinal time to or time from event, we actually calculate the days. So we don't give any dates. We just give the time in dates, a time in days or months between events so that we don't have to give dates. And we also round off numbers, things like birth weights, things like viral load measurements. If you think how stigmatized it is for people living with HIV already, you don't want any risk that viral load measurements can be tracked back somehow because they have these large numbers down to, very granular numbers. So you can round them up, you can put them in categories, same with CD4 counts. So k-anonymity sort of speaks to what you were asking about. Are there some rules or guidelines? So K-anonymity, it's a concept where you say, for every identifying attribute a person has, so maybe it's my age in years, there are at least K-1 others with the same value. So if I end up in a study and there are 17 people with the same age as me in that study, then it would be an 18 level anonymity for that particular field. So you can set some cutoffs and you can round up or round down to ensure that for every value, there are at least K people in the data set who have that same value. So that's one of the measures that's used. People have different ideas what's acceptable and what isn't. Personally, I think 10 is a little sparse. I would go for higher, but you can do more with the larger your data set, the more you can make sure that you round off and you can increase your value of K, yeah, essentially. What did I do? There we are. So I also wanted to just mention, so data aggregation is another way to deal with very sensitive data. So you want to make sure, I'll come back to third-party stewardship. We have a rule of thumb, if the data aggregation is 15 or less individuals, we don't report it. Or we'll say less than 15. So imagine if you have, geographically, you see this so abused. I mean, it's shocking. If you can imagine that you have a space of 4 blocks and you have 2 people with multi-drug resistant TB in those 4 blocks, it's not hard actually with those data to do a bit of sleuthing work and you can work out who those 2 individuals are, for example. So geographically, we really, I really implore everyone, it's super cool when you do those ArcGIS plottings and everything, but nobody should be putting dots on maps for individuals with any kind of health data. So you look at aggregates for regions, for suburbs. One of the ways you can do it is hexagons, and you change the size of your hexagon division and you do counts per hexagon. So it's more like a heat map. And you make sure, I'm sure you've all seen in COVID, I mean, hopefully you only saw suburbs or sub areas that were colored in a heat map of caseload. But really dots on maps are an incredible invasion of privacy and an incredibly accurate way of identifying who's got what illness. Yeah. Yeah, so I was actually in the Gates meeting last year, the Grand Challenges meeting, and there was a bit of a bidding war on what's the aggregate amount. So people were putting in their different offers, what's the minimum number in an aggregate. But around 15 to 20 seemed to be the rule of thumb. Trusted third-party stewardship, I think we talked about this maybe yesterday, or last week. But sometimes you need to join data sets and you need to have those linkage the identifying information to be able to do joining. And this can be, I mean, it can be a real blocker. You may have ethical approval to join data sets and you may have everything in place to be able to do a fantastic analysis, approvals, even consent for the use of the de-identified data. But then you have to bring these data sets together and do the linkage. And that can be something that it's people who are in the study shouldn't be able to see the identifiers of the data. So you can get the services of a third party who's independent of either study. They have no interest in that data set. They're known, they're trusted, and they can do the join for you of the 2 data sets. So they sign an MOU, an agreement, that they will do this, that they'll destroy the data afterwards. They do the linkage, they create the big data set, they do data perturbation so that nobody can re-identify who's who in there, and then they release back to the collaborating parties this big joint data set that nobody knows who's who, they just know that this is the product of the 2 data sets. And they destroy everything that was given to them to make this possible in accordance with the MOU and NDA they've signed. So I've done that role for a couple of studies, doing the linkage. You need someone who's coding you trust, because you can't go and verify that they did the joining correctly, etc. But yeah, this is another way to deal with this issue of identifiable data and needing to use some version of the identified data before the perturbation, etc. So this is just a summary really of what I've mentioned so far. I find this for me a useful kind of rubric just to refer to when I'm not sure. So when can we do data sharing? If you have aggregated data, I would say if the count per aggregate unit is sort of 20 and above, you're probably in a relatively safe space. I mean, use your own judgment, and this is where understanding the data is also so important. If you understand the data, then you might know the risks associated with it. And there are also very different levels of stigma, et cetera, that are attached. I mean, in the height of the COVID-19 crisis, having COVID wasn't really stigmatized because, let's be honest, everyone was doing it at some point or another. And it was just something that was your misfortune, but not a societally difficult situation to be in. At the beginning of the pandemic, it really wasn't very nice to be the index case who had brought this much feared infectious disease into your country. And maybe, I mean, certainly in South Africa, the initial cases were not, they were people who traveled a lot and they were from a more affluent sector of the population. So there were all those dynamics that came to play. You know, you don't really want those people to be put in the public eye in an unfair way. So you have to also use your own judgment to say, is this stigmatizing? Could it be stigmatizing? I had another colleague who once described, I mean, they're from Uganda, from Entebbe or Kampala area, and they were in an epidemiological group, and someone, you know, stood up and gave a talk, and they talked a whole lot about how Kampala was a hotspot of HIV infection, whatever. And this colleague said that they felt all the eyes in the room sort of swivel around and have a look at them because they came from there. And although they could laugh it off as an epidemiologist, it's actually not right to put people in that situation. It's not appropriate. Yeah. So yeah, de-identified data, data perturbation, individual data, IRB approved, informed consent. I didn't talk about the IRB approvals, and I'll talk about it more tomorrow, but on Wednesday. But you also need ethics approval, even though it's secondary use, whatever you're planning to do with data, if there's anything originating from a human in your data or an animal, actually, I don't do animal work, so I'm not a specialist on that side, but you need ethical approval to work with those data from your institutional review board. If you're working with health data from your Department of Health, whatever structures they have. And then data set linkage, you need either informed consent to do the linkage or trusted third party and anonymization and perturbation. Yeah. So how can we do data sharing? I just wanted to talk about 4 ways, technical ways of doing data sharing, because we tend to think of data sharing means I've got all these data and I give them to you and that's the end of the story. But actually that's not working in a lot of situations. So I want to talk about some other ways of doing data sharing that might speak to tricky situations and actually be solutions where we can do the research we want to do, but we don't have to compromise on privacy, on what informed consent was provided, etc. So we do actually have a paper. We just got the first review back, and with some minor amendments, hopefully that will be in press soon. And this is more detailed and description of these different ways of doing data sharing. So hopefully that will also be an available resource soon. So direct sharing, this is what we all think of as sharing. I've got a great data set, you want to use it, we have some kind of agreement, I hand it over to you, and that's the end of the story. So it's very unidirectional. And I'm not going to go into much detail. I think we're all used to that model. The collaborative analysis, we talked about this a little bit when we were talking about data standardization. This is when you have the data from 2 sources. I've got a great data set, you've got a very similar great data set. We want to do an analysis on the whole lot together. So we write an MOU, how it's going to work, and we combine the data sets, anonymized, and we do the analysis. And then we together, publish the results of that analysis. We do the work together, we write the paper together, and it's a kind of joint effort going forward. So we refer to that as collaborative analysis or meta-analysis. The third way we talked about is the federated analysis. I've got a great data set, you've got a similar great data set. I don't have ethical approval, or I don't have informed consent I would still get ethical approval for the study, but I don't have informed consent to give you those data for whatever reason. Sometimes we have these legacy data sets that were collected before people were doing informed consent properly, and we don't feel that we really have the right, because the informed consent maybe wasn't up to scratch. We wouldn't hand those data on. But those data can still be used by the people who initially were given permission to use them by the participants. So in the federated analysis, we would agree what is going to be the study we're going to do, what is going to be the analysis we're going to do. I would do it on my data set in my environment. You would do it on your data set in your environment, according to the same analysis kind of structure and process, and then we would combine the results and publish those together. So my data never leave my care and my oversight. You don't ever see my data, and vice versa. And this is privacy protecting for instances where you really can't share those data. So other reasons you might not be able to share them. Sometimes we have de-identified routine health data, and individuals really didn't give permission for those to be used for research. So where we can anonymize them, we may then do the research in-house, but we're certainly not authorized to then take that data set and pass it on to other people to do their research with it. There was no informed consent given in the first place. So we may have a waiver of consent for us to use those data, but we can't ethically, in good conscience, package those and hand them on. But we can still get good value. I think that's what I'm trying to demonstrate here, is that we can still get good value from data. We don't have to be stuck on the single model of I give the data to you, and if I can't give them to you, then the work can't be done. There are other ways of doing it. The trusted research environment, I already explained to you about trusted linkage, but another way that people are doing this, and this is becoming very popular, is to have an online platform that's kind of locked down. So the data are on the platform. In some of those, the data are kind of screened, so you can't see the real data. You can only see what are the fields, what do they maybe look like, maybe an example line or two of the data. But then when you are granted access and approval to use the data, you log in, you do your analysis on the platform, and you take the results away with you from your analysis. You can't download the data, you can't screenshot, or you shouldn't screenshot the data. You can't actually see the data, you can only run your analysis. Another reason actually that TREs are getting more popular, the trusted research environment, is because the data are just getting bigger and bigger and harder to move around. That's another reason why we have these analysis platforms. But they certainly solve this problem where I can't hand my data out and give them to someone else to work with. So I hope I'm sort of communicating to some extent that this is really a kind of whole ecosystem. This is not just about holding a data set and deciding what you're going to do with it and who you're going to give it to. There are other people involved. There's a whole people element. How did you do the informed consent? How did you inform your research participants what you were going to do? Was the information adequate? You've got ethics approval. Often you do community engagement. There's scientific citizenship where you're giving back around the data and you're talking to the participants about what this means, what the science means. And then there's also the processes around data governance, also training so that you know the work being done is effective and good research, and mentoring data science. And then the kind of data sharing, the integration, meta-analysis, and integrating the different data sets. And all of these things are important through the whole data ecosystem. So I just want to talk a little bit about data and biospecimen sharing from when we have data and biospecimens from the Global South. I know you guys are mostly interested in data, but the data obviously come from biospecimens. So forgive me for wrapping them all a bit. So I want to talk a little bit about equity. It's also a big catchphrase. It's like a big virtue signaling thing, like we care about global equity is important to us, et cetera, et cetera. You'll hear a lot about it. And I really encourage you to ask people, so how exactly do you do global equity? Because I think we're at the point where people know they want to do it, but they're not sure exactly how. So traditionally, there have been these inequitable power relationships where you have funders and collaborators coming from the global north. And we see this a lot in Africa and across Africa. I'm not pretending to speak for other experiences in the global south, but I suspect that this is probably not a new story to many of us in the room. So there's this inequitable access to resources and infrastructure, and we call it helicopter science, where people who are well-funded from the global north kind of fly in, the people on the ground do all the hard work, setting up the studies, collecting all the data, collecting the specimens, they get handed over, and then the people from the global north leave with them again. And they do the nature papers, et cetera, et cetera. So yeah, the other term for this sometimes is, it's a slightly different scenario, but it's called ethics dumping. And that is when people from the global north come in and do the kind of research that ethically they would not be allowed to do in their home countries. And they sort of slide in under the radar, maybe of slightly less informed ethics review boards, et cetera. There's a great book about ethics dumping that has a whole lot of examples. If anyone's interested, I can give you the link. Actually, what we found, and then there's this unidirectional flow of samples and data that just gets sucked off into the global north. And we find the funders for many of the studies historically, they actually insist that you put your data into these centralized repositories and that you put your samples into centralized biobanks. And we actually have researchers who find they can't access the data and the samples from these repositories when they collected them in their environment, their local environment in the first place. And then there's no benefit sharing from any secondary use. Once the data are put in kind of centralized repositories, then there's no leverage to try and get anything back when people use those on. And again, speaking for Africa, it's really not easy collecting samples, building big data sets, generating data, storing data. It's really, the overheads are high, and it's really not an easy environment. So it can be quite a pain point if you then have to hand all of these over and some very big, well-resourced lab kind of scoops them up and does the paper that you would like to be doing. Yeah. So there are a lot of issues around this sort of inequitable process that it's starting to shift, but historically that's what we've dealt with. And because of these historical inequities and there are these current barriers now that we have, certainly in my environment, where people don't want to send data and biospecimens off continent. And there's a kind of resistance now to just handing stuff over, centralizing stuff. There are also more legal limitations. Like I said, we can't send genotype or genetic data off continent unless we have very specific informed consent for sharing internationally, sharing the data internationally. There's this risk of being scooped in your publications. And we all know publications are how you keep going as a lab. And then you don't know also if the data or biospecimens are used according to what you agreed with your participants. You've got no oversight going forward. And then you lose access. And then also the issue I mentioned already, sometimes you don't have in the legacy data sets, you don't have informed consent to do this kind of centralization. The same with routine health data, for example. And data can be too sensitive for open sharing, like genomic data. Clinical trial data, sometimes, I mean, you just really can't package the stuff and hand it out. It's really just very sensitive information. And personal health data are always very sensitive. I don't know if people remember some years back, there was a breach of an HIV database for people living with HIV in Singapore. And the repercussions from that were really horrific for those participants, or they weren't even participants, they were healthcare clients who were affected by that. And I always like to remind people, so if you use your data inappropriately and you are the cause of a data breach, I mean, your career might take quite a hit. But if you're a person living with HIV in an environment where HIV is highly stigmatized and there's a data breach, your life grinds to a stop. It's not a glitch in your career. It's a really catastrophic event in your life. So we need to remember that if we're working with data, that we really are holding people's emotional and life well-being in that data set we're working with. And then finally, our research sustainability. I don't know anyone in Africa who does cost recovery for sharing onwards with their data or biospecimens. I see it's more common in the global north that if someone wants to use your samples or data, you can ask for some money towards the cost of having generated those, but we don't do that at all. And it's not really allowed by the funders, to my knowledge, but I stand to be corrected on that. Yeah, and we just don't have benefit sharing. So there are lots of funder requirements for data sharing plans. How are you going to make the data available? What are you going to do with the data and biospecimens so it can be used onward? But I've yet to see a funder who says, and what is the plan for benefit sharing for the populations from whom you get these samples and data, and the community and the local researchers who do all the work on the ground. I've not been asked for that one in a grant application yet. So I'm just going to tell you a little bit about our platform. So I will tell you also why it might be of interest to the community here. But I'll just give you a little run around over what we're doing. This is work in progress. We're hoping the platform will be ready around mid-year next year. So it's African Data and Biospecimen Exchange. Has anyone used eBay, or do you know what eBay is? Yeah. Okay, so at least some of you. If I say this is like an eBay for data and biospecimens that are generated in Africa. So we're building an online platform, and the idea is to connect, and I talk about resources because I just get exhausted getting data and biospecimens out all the time. When I say resources, I mean data and biospecimens. It's an online platform to connect resource generators, the people, the researchers on the ground who are generating data sets, biospecimen collections, and to connect them with people who want to use those resources. So other researchers, they might be in your country, they might be abroad. And we want to, with the platform, the aim is really to address the barriers today to sharing data and specimens from Africa. The barriers I mentioned, reluctance to send these things to centralized repositories, also concern about what happens next, are the ethical considerations being met, and the informed consent restrictions, are they being respected? And also, are we getting anything back to help us sustain our research? And are we getting any benefits for the participants from whom these resources originate? We also want to ensure that people start building more equitable data sharing agreements and benefit sharing agreements. So the platform, it's going to be browser-based. It's an online kind of interactive catalog of data sets and biospecimens. And it's only about the metadata. So it's the data about the biospecimen collection or the data about the data sets. And then, yeah, we've got the resource generators on the left here in this figure, the resource consumers on the right. And then we have all these different functionalities. So I will just talk through a couple of them so you have a sense of what it's going to look like. So if I have, let's say I've got a great data set that I'm sitting on, I don't want to send it to a centralized repository, and maybe it's awkward to reformat it how someone wants it, or maybe I can't for ethical reasons. Or maybe I just actually, I've got work to do on this and I'm not ready to share before I've done the research that my team is planning to do. So I can create a new listing and upload the information about the data set and essentially give visibility or advertise that I have this data set that I can share under certain conditions. I can provide all the information I like, but I don't send that data set anywhere or the biospecimen collection. It stays with me. I can create this listing. We've got, and then, I want to clarify the resources remain with me. Nothing's getting sent anywhere. And at no time, at any point, will this platform hold any data, actual real data, and at no time will it ever be responsible for any data sets. It's only the metadata. So once you've created the listings using like a drop-down menu, etc., if somebody's looking for samples or data, in our case, we're interested in data sets, then they can go and search for the kinds of data sets they're after, and maybe they will find your listing and it looks interesting. And at that point, they can start to chat with the person holding the data set that they're interested in, and you can start to negotiate. Oh, I'd really like to use that data set. How about, this is what I want to do with it. What do you think? Well, actually, we wanted to do something similar for my master's student project, but maybe we could collaborate and you could give them some training in the process, etc. You can do all, yeah, sure, have the data set. So the person holding the data set or the specimens has the control over what happens next, and they can discuss and negotiate through the chat. So at some point, maybe there's an agreement, let's go for it. We're going to do this. I just want to mention people from my team. So Dr. Eddie Lelamba is a postdoc in my group, and he's been building the metadata structure. So remember, I talked about ontologies, controlled vocabularies, all of those things. For the metadata, we're trying to standardize as much as we can, so that when we capture the information on listings and we have search terms, that all of these things work in a standardized way, and things are mapped so that when somebody wants to find a data set about COVID-19, they will actually get all the data sets about COVID-19. So just recognizing this immense amount of work that Eddie's been doing to pull all the metadata for each data type and biospecimen type we expect to list. Once we've decided, or you've decided through the chat what you're going to do, then you can select the kind of sharing you want to do. So we have templates for the 4 that I talked about already, but there are also the option to create your own type of collaboration or sharing, however you want to make it. And throughout the process, there will be prompts and suggestions. It can look like this, you can do it like that, but everything's modifiable. So although we're putting in as much leading information as we can, it's up to you and the person you're writing the agreement with what you want to do and how you want to make it look. So the prompts will help remind you what should be in there, but you've got a lot of flexibility to then turn it into exactly what you need. And then we've got a whole process that will help you build your data sharing agreement, make sure you don't forget any of the important clauses, and help you to build this memorandum of understanding about exactly what you're planning to do. So before anything's even changed hands in terms of your data or biospecimens, you're going to go through this process and set up the agreement. We specifically decided that we won't try and create a legal document because there's no way we would ever be able to craft that to suit everyone. So we've made it like a very person-friendly agreement that you can negotiate. But then at any point you wish in this entire process, at the chat or the building of the agreements, you can invite in institutional representatives, your PI, your tech transfer office, whoever it is you need overseeing this can come and join the conversation at any time and make sure that they're also happy with this process that you're going through. You can negotiate your benefit sharing. Yeah, you're a very well-sourced group. The clinic where we collected those data, they don't have a -20 freezer. Maybe you can afford to donate one. Whatever it is you want to get out of it, you can start to build that in at this stage. So just also to recognize the other postdoc in my lab, she just, when I made these slides, she was not quite a doctor, but the week before I arrived, she had her formal graduation, so she's a doctor now. And she's been working on building the modules for this data sharing plan and the data sharing agreement, so that as you go through, you'll be prompted, have you thought about this clause? Have you thought about that? How are you going to do this? How are you going to do that? Again, everything's up to you, but this process will guide you and remind you what you ought to have in there, and then you can modify it to suit your purposes. So we finished our first year. This is funded by money from the Bill and Melinda Gates Foundation. It's a Calestis Juma Fellowship that was granted to me. So just acknowledging the funders. Our first year of funding, we did a very detailed specification of the functionality and the user experience with this team, Homonym Global in Cape Town. And they did the front end design and did the user testing and the functionality testing with users to make sure that it's fit for purpose and that the interface makes sense. We did the metadata structure, search term functionality, and then we have now a group who started the coding, and they did the back end spec. So we had a detailed spec before we started writing any code, and now they are starting to actually code. So we've designed it to be containerized, something like a Docker type approach. And part of this is so that if an Indian institute decides they want to set up the Indian Data and Biospecimen Exchange, we can give Docker a containerized code dump, and you can very easily modify it to suit your branding and your environment and deploy something similar. So the idea is that we would like the code to be repurposable by anyone, any other group who wants to use it. It's also optimized for restricted internet bandwidth. So it's loaded. I don't understand all the tech because I'm not a coder, but a developer, but it's loaded to the front end so that the tax on the searches, the internet tax is very, very small. So we want it to be a fluid experience. We're deploying it on our local cloud structure. And this is, I think I already told you this. We just had our first stakeholder workshop to make sure everything's running smoothly. We did user testing. We had an in-depth stakeholder workshop. And yeah, we're now looking to have, so we're hoping it'll be up and running by mid next year. So first testing version end of this year. By mid-year next year, it should be deployed. So yeah, sorry, I ran on a bit. I had a bit much more in here that I intended. But yeah, I just wanted to share with you the kind of tools and the kind of ways to manage data sharing, making sure it's equitable, making sure it's ethical, but still making sure that we really promote the onward use of data. So thank you.
Thanks very much, Nicki. And questions? Yes.
This data sharing platform, is it open to only academic researchers, or say a startup can access, or any other private limited companies can access?
Yeah, so that's a good question. So essentially anyone can access and search. We have a restriction on user profiles that you must provide a real name and you must have an affiliated institution, be that a company, be it a university academic institution. So we wanted to keep a fairly low barrier to entry, but enough information that we don't get, trolls and spammers and those kind of things. So there is a need to register a profile, but anyone in a sort of valid position is able to do that. So yes, absolutely. And then it would be between, if you're looking for at my data and you're from a company, it's up to me and my tech transfer office and my legal team as to how we want to craft that. So commercial use is one of the types of data sharing profiles we have. And a lot of that will say, we're not qualified to advise you on IP, etc. Make sure you contact your legal department. Yeah. In theory, anyone who's interested in the data and has an affiliated institution can go and search. But we restrict posting to people who are generating data and biospecimens in Africa. Yeah. The listings, yeah.
Thanks, Nicki. Wonderful talk. I have two questions linked to each other. So the first is, the African biobank data or the specimens data. So what are the sources of these data that you are accessing, and how did you get access to that?
Yeah. So what we know is that researchers have their own data collections, and they have their own biospecimen collections in their fridges and freezers, etc. So that is one is individual researchers or maybe institutes who want to share or make them available. So we have individuals. Actually, we have quite a vibrant biobanking culture. So we had our workshop in Entebbe where the MRC Uganda sits. So they have a lot of legacy samples where they are encouraged to use them and make them visible, and they haven't had a mechanism to do that. They have about 3 million samples of various descriptions. So we'll actually, our next workshop, I think the next workshop we hold will be a hackathon to build the API, and we'll aim to suck the data from these big biobanks automatically to populate their collections on the biobank exchange. So that, because obviously they don't want to sit and enter every single data collection they have manually. So we have built into this spec that we'll have these APIs we have that biobank is a huge one. Then we have 3 H3 Africa biobanks for genomic data. And they also have a catalog. So we also work with them to suck those data in. I know most of them use FreezerWorks, so we have to explore if there's a metadata structure that FreezerWorks allows people to see because it's pay for software. So we have plans to do metadata import from these big collections in collaboration with the groups, yeah.
Thank you. And as I understand, you avoid the legal challenges by not hosting any data on your platform. But to link to your first part of the talk, do you see challenges if there were actual data to be linked for the anonymization and privacy side of things? Because when you said that large granular data should be treated as re-identifiable, and the example where we can round up the 3.5879 to maybe 3.5, but when you link it up with some other sources of information, the k-anonymity or diversity algorithms will fail. So, I mean, the practical question is, do you see challenges if when this comes to real data exchange solutions, other than the metadata exchange solutions?
Yeah, so we will never handle any data sets. So the closest we'll get to that is saying, here we recommend this secure server for transferring data or that secure environment. Or we recommend these couriers because they seem to manage okay with dry ice across African borders or whatever it is. At no point will we ever facilitate the transfer. So we're building in a resource section. So when you're doing your data sharing agreement and it says, what are the anonymization and perturbation plans for the data set, then there will be a link that goes to a how-to. So rather than being prescriptive or trying to do it ourselves, it's about prompting and reminding and providing information and tools so that we can help people do it better. Yeah. But we will not at any point be involved in hosting any kind of real data. We'll only ever host metadata. So from our side, it's about trying to make it more accessible to do it better. I mean, even having a data sharing agreement for a lot of these things will be a novelty because, you know, historically people didn't do these kind of collaboration agreements. And yeah, so our idea is to facilitate, not to be the doers, but to make it easier for people who want to do transferring, sharing, moving data around. Yeah. So we'll try and provide useful references and how-tos. Yeah.
Any other questions? Yeah.
Thanks. I want to understand how this looks from a participant's point of view, probably very naive questions. Let's say, what fraction of participants are very permissive with consent, that they give consent for most kinds of analysis? Presumably, like maybe I'm assuming there are some people are okay sharing their data for most kinds of analysis. For them, then just ticking each of these checkboxes akin to reading like a long terms and conditions document, and perhaps beyond a point they won't even read. So I don't know, maybe I'm getting it wrong, but.
So are you asking about the informed consent from participants who the data and biospecimens are collected from?
Yeah.
Yeah. So that entirely depends on the researchers and how they've conducted their studies, obviously. So I don't get me started on the kinds of informed consent protocols that I've seen in play. Let's just say a large part of the work I do in the ethics and governance space is to try and offer tools that people can use to improve the way they do informed consent, for example. So we really have a problem where a lot of the informed consent is so uninformative. Commercialization is a huge example. So when you look at the informed consent, you can go through the template in detail. But you can get to the end and you can say, so were these participants okay with us commercializing their data? And you still don't know. And in that case, then you will always err on the side of caution and say, we can't use these for commercial purposes. We can't hand them over to a company, these data. So it really depends on the care and the level of detail and the kinds of information provided to participants. And I have to say, historically, it's been very weak. Yeah.
Sorry, so you had shown a list of like tiered consents, different.
Oh, yeah, that's
So-
for my own study.
so
Sorry. I
that's
didn't
something that a
clarify.
participant will have to check on when they submit their data or when a
So
sample is
yes,
collected.
sorry, I should have clarified that. So I run my own cohort study.
Yeah.
Separate to this, where we collect data.
Yeah.
And we collect samples. So for me, those are the checklists. Our consent asks questions for each of those items. So it will say independently, are you okay for us sharing? I mean, obviously it's couched in terms that are manageable for our participants, but in essence, are you okay with us sharing summary statistics of these data? Are you okay with us sharing these data with international, across borders internationally? Are you okay with us using these data for other health-related studies? Are you okay, because we collect often for a particular illness, we collect in the diabetes clinic. So we make clear we'll do diabetes studies, and then we say, and are you okay if we also do other studies? We ask a very important one for us, because we're doing a virtual cohort where we have a genotype. We just get a buccal swab, we get a genotype, and then we link it to routine health data and update prospectively. So it's kind of a data-driven virtual cohort. So importantly for us, we say, in the future, there might be other studies that you might be eligible for. May we contact you if we think there's a study and invite you to participate. And at that time, you can say yes or no, and then they can say, yes, you can recontact us. Yeah. So that whole consent framework is what I use in our other work, to try and be more specific and make sure if someone says to me, so did your participants consent for international transfer? I can go and look and I can see these ones did and these ones didn't. Yeah.
Thanks.
Yeah.
Anyone else? Yeah.
Yeah. So sometimes like when you search the database and you will find that like there is no data available in that particular platform. Is there a way that we can request? It's like this is the data that are required. So providers can get this kind of notification saying that we can provide the data like that. Anyway, such fine.
So are you saying when this is up and running,
Yeah.
to have push notifications?
Yeah.
Yeah, so you can flag on your user profile, you can flag your areas of interest. Yeah. So the back end, I've got very clever developers. It's not me who does this, but so if I sound a bit fluffy, it's because I am a bit fluffy about it. But essentially, depending on what you search for and how you search, you will have prompts about what's available, pre-populating for your particular interests. And you can tag what if you see someone who's doing interesting work and you want to see what else they list, you can follow them. Yeah, there are various things you can do to get notifications as things.
Maybe it's like let's suppose like I have asked the X data and this platform doesn't have that data. And in the situation, the providers, is there a way that the providers will like go to notification, start collecting the data from that point, can upload the data because my request sent to that? Is there any chances there?
So you're saying if you ask them to, so you can contact the person who listed the data, say, I really like the study you're doing. Is there a possibility to collaborate? I would really like to collect these data from your study population. And that's between you and that person, that other researcher.
But if I understand the question correctly, you're asking some data is missing from the platform, but all data is missing, only metadata is there.
Yeah.
And only data that is relevant to the metadata could possibly be requested via the platform.
Yeah.
If there's something else you're looking for, as Nicki says, I guess you should talk
Yeah.
to them directly. Yeah.
Yeah, if like maybe I'll put it in right way. So there is like I require a data which is like new data which is not available in the platform. Is there any way that the provider is already provided some kind of data and I need additional features from that particular providers? Is there any way that we can ask that person directly in the channel?
So if I'm understanding correctly, I mean, there's a chat function.
Okay.
So you can send a chat just like you do
Okay.
on any forum. You can send a DM to that person and say, I really like what you've got, but can you tell me, do you have this? Do you have that?
Okay. Okay.
So there's you can chat directly. So there was, let's see if I can go there. Sorry, I know we've gone over time. Maybe if people want to leave, can I just say you're welcome to leave as
Sure,
well?
people can leave if they want. Also, in the interests of, we should probably wind up in 5-10 minutes.
Yeah. Yeah, you see the start chat. You see it. Oh, sorry, I see the resolution's not great here. It looks much better on my screen. That button says message. So if you do a search, you're looking for, let's say you're looking for TB, MDR TB data, and you do your search. And then there's a listing and you see one that looks sort of right, but you're not sure. You click on the listing, you have a look. And if you're interested in the data set, you can message. And that will, you can write a message to the person who posted the data set. I like the data set, but I was wondering, does it have this field? What are your terms for sharing? Are you interested in a collaboration? Whatever it is you want, yeah. Does that answer your question? Oh, okay, yeah. So there's this direct interaction. One of the other features of it is, of course, then whatever you've chatted about, it's all stored on the platform. So there's a immutable record of the discussion you had. So at any point, if there's a dispute, you can go and check your message history, and it will all be there. Yeah. But if I didn't answer your question, come and ask me after. Okay. Great.
Actually,
thank
I had
you.
a short question about the K anonymization. I might have missed it, but essentially, like when you say somebody is age 30 and there are K others with that age, is that K from that data set or is it from the general population?
It's from that data set.
And
So, yeah, sorry.
so my reason for asking is that unless you know that somebody contributed to the data set, to identify them, you will actually need to look at the population. If it was a population in Cape Town, you don't know for sure whether they're part of the data set. So what you need to worry about is using these parameters, age, income, whatever, can you identify someone from the whole population, right? Isn't that a harder?
So how we've used it. So for example, the baby example, baby weight example. So clinicians, what's a normal kilogram range? Maybe in your data set, the babies range from 2 kilograms to 4 kilograms. Is that a reasonable?
Yeah, maybe 1.8 to 4. I don't know.
Okay, whatever. So
Depending.
for ease of sums, let's say 2 to 4. So if you had 100 babies in there and it was evenly distributed, if you just went to kilogram, they would either be 2 kilograms, 3 kilograms, or 4 kilograms. So you would then have, what did I say, 100 babies. So you would have 33 in each group. So that would be a 33, K would be 33, because there would be 33 people who had at that 2 kilograms, and 33 who had 3 kilograms, and 33 who had 4 kilograms as a value.
Yes, but my question is more, is it too stringent a condition to restrict K to your data set? Because unless it is known who could have been possibly a part of that data set.
Yeah, so the concern would be, I mean, if you had a data set of premature babies, okay, I'm sucking figures
Right.
out of the sky here, but let's say you had a data set where you only had one premature baby and they were 1 kilogram.
Yes,
But in the population, you have a much higher proportion.
exactly.
Then you would be able to identify that one child in your data set, because for 1 kilogram, there would only be one individual.
But anonymity is about identifying in the population, right? I mean, in the population of Cape Town, there might have been 100 or 1,000 such babies. And you cannot identify in your data set because, I mean, there is no identifying information. I thought the idea of identifying is your data set indicates a 45-year-old woman with a history of 3 pregnancies who lives in this postal code and that kind of thing. Then you can go out and actually identify that person in real life in the general population. I thought that was the worry. Similarly with genomic information in the general population, you can pin down that person. But in the data set, since you don't know who's there in the data set, I don't really understand why it's important.
So often the data sets we provide will be, please can you provide us a data set of all babies who were born in Mowbray Clinic in this month?
Okay.
Yeah, so if you only had one baby who weighed 900 grams, then potentially you could go and look at your folders for that month and find the one
So
baby.
if you know what the hospital is, then you can find it.
Sorry?
If you know which the hospital was, then you can find it.
Yeah.
Okay, yeah.
So because not all the data sets are general population data sets, they're often quite specific. So in a way, the general data population it's less fraught because it's a much bigger population and you don't have a single data set of the bigger population. It's when you have specifics that can help you work out who it is. So an example we had as well, we were doing the births registry kind of information and there was someone with 5 babies. What's it called? Quintuplets. And actually one of my colleagues without thinking was like, wow, that's amazing. And then she said, oh, what was the date of birth? I wonder if we can find it in the news. And I, no, you can't do that. But actually she could have probably Googled and probably they would have reported this woman had 5 babies, had the woman been amenable to being in the news for having 5 babies. She probably could have worked out who she is.
So you're saying such data of quintuplets cannot even in principle be shared in any form, whatever, because you can identify them.
Actually, yes. I mean, you know, maybe that mom doesn't want to be in the news for having 5 babies, or she doesn't want people to single her out for having had 5 babies. Yeah. So it's quite tricky. Yeah. Sorry, we really got
Yes.
time.
Okay. So let's thank Nicki again. And yeah, she's
Thank
about
you.
to-